Hi, my name is AJ Clevenger. Today we'll be doing a Barium Enema exam. So what I want to go through first is the supplies we'll be using today for the exam. So what we have here is we have the Barium Enema kit. Comes with a little clip for the bottom. Has barium powder inside. What else we have here is we have some water, lukewarm water. It's about 500 ml. We got gloves here. Want to stay clean. We also got towels for any cleanup that we need to do. We also have some KY jelly for lubricating that tip, because you want the best experience for the patient. You don't want anything that sticks to the patient, if you know what I mean. Also, we have a hemostat, which we'll be using in a little bit. But first, what we want to do here is we want to mix in the water with the barium here inside this bag. What you want to do is, use your finger inside first, get a little bit of distance, be able to pour in this water in here. So, kind of a little pouch, pour in the water. Make sure you clamp on the bottom. It's 500 ml. There we go, just like that. Ooh. Yeah. Okay, so what you want to do is put the cap on top. Can't have the barium leak all over the place. Make sure you seal this really good. Just like that. What you want to do is you want to mix this barium and water together for about 30 seconds. Alright. Sounds about mixed up there. Alright, about 30 seconds. We're still clamped here on the bottom. So after mixing it, what you want to do is come over here after being mixed up. So what you want to do is hang the bag up about 24 inches above the patient's rectum. And we have the clamp still here. We got the hemostat clamped off, and what you want to do is you want to get out all the air inside the line. You don't want any air inside the bag or going to the patient. Also, what we have here is the enema tip. What this does is goes inside the patient's rectum. Usually this has a balloon inflator. When it goes inside, you got the 90 ml of air. Has a little clip here, so we want to stop the air from coming back out. It also has air contrast to be pumped inside the patient as well. And I think that's it for now. Alright, we got the room all set up here for the barium enema. What we're going to do now is get the patient. Hi.
Hi.
Are you Alfredo?
Yes, sir.
Pantoja?
Yes, sir.
Hi. Can I get your date of birth?
Yes, sir. 6/7/85.
85. Alright.
Yes, sir.
So what do you know what we'll be doing here today?
I just heard. I'm actually not sure.
Not sure? Okay, let me come right over here. So what we'll be doing today is, it's called a barium enema. Basically what we're going to be doing is putting a rubber tip up your rectum.
Okay.
Yeah, it sounds kind of grody, but this is what we got to do to find out whatever your problem is. What kind of problem are you having right now?
I suffer from chronic polyps.
Polyps? Oh, okay. So have you ever had surgery before?
No, sir.
No? Okay, so have you ever had a barium enema before?
No, sir.
Alright, so this is the first. Okay, so like what I said, we'll be putting the tip in your rectum.
Okay.
We'll be doing various shots, and the radiologist will come in and do some floral, which is, movement and stuff. So if this is a female, you would always ask if they're pregnant or not, of course. But yeah, so let's get started. Anything else? Any questions?
I'm not pregnant.
You're pregnant? Are you pregnant?
No,
okay.
I'm not.
Right,
Yes, thank you
great.
for asking, though.
Okay, so what we're going to do is putting the patient on the table here. We're going to put him supine. Go ahead and lay down, sir, on your back.
Okay.
Yeah. Like that. Alright, you need assistance? You got it? Alright, great. So what we're doing is a KUV first, which is a scout. Want to make sure that everything's clear of the colon. Everything's good. We'll be doing 14 by 17 here. quick. Okay. There we go. Okay. Make sure our tray's lined up here, which it is. Alright, so we center at the Elliott crest here. Feel for your hip bone here, sir.
You have a gentle touch.
Alright, yeah. Really delicate with my patients. Okay. Alright, so let's say we're about lined up there. Yep. Okay, so this is kind of a larger patient, so I'll be shooting maybe KB at 80, probably going at 40 mass. Alright, sir, go ahead and take in a deep breath. Let it all out. And hold it. Alright, let it breathe normally. Alright, so what we do is we'll go ahead and run that film real quick, see if everything came out, make sure there's nothing, no particles left over in that intestine, make sure he did what we supposed to have told him before this exam, which is, taking laxatives or, have a liquid diet or something. Alright, so we just did a scout KB, so now what we're going to do is have the patient lay on his stomach. Alright, so we're going to have him lay on your stomach there. And what we'd be doing is a Sims position, so we bend that right knee up. Alright. And usually we cover the patient with the sheet, you don't want to overexpose or whatever. But anyways, what we're going to do is get the tip here, the enema tip, get our handy dandy KY jelly. And then what we're going to do is lube this up quite a bit. Be very generous on this. Make sure the patient is comfortable as we tip this patient in. Alright, so what we're going to do is spread his right cheek up. And then we're going to insert it inside. And then it's going to go in 1.5 to 1 inch inside the rectum. And then you want to follow the contour. And then it would be like 2 to 2.5 going towards the umbilical area. And usually the radiologist will pump up the balloon inside so that it doesn't slip out. But in this case, we'll go and do this now. Alright, look a bit so it stays in there. Alright. Alright, so what we're going to be doing now is the LPO. So we're going to get the patient to his side here with this 45-degree sponge here to help him out. Alright, so we're going to turn to your left side here. So this would be AP. What we do is get the right, sorry, there you go. Get the right marker over here, since his right side is AP. What we do is center at the Elliott crest again. Here. Alright. So what we're going to do is shoot him at 110 at 20. And so we're going to take a deep breath. Let it all out. And hold it. Beep. Alright, now what we're going to do is do the same position, LPO. We want to see the sigmoid, so what we want to do is angle the tube a little bit to 30 degrees. And make sure your monkey is lined up there. Here. Alright, so for this position it's 30-degree angle. We're going to do for the Elliott crest again. And then actually for the LPO axial, what we'll be doing is the We're going to be lining up the CR, centering at the right below the pubic symphysis. Right there. And I'll be shooting this guy again, the same thing. Be like the 110 at like 50. Alright, so we're going to take a deep breath, let it all out, and hold it. Beep. Alright, so the 10 by 12. Alright, so what we're going to do next is we're going to put in the 14 by 17. Alright, so we're going to have you lay on your back. So we're going to take off this angle here. So what we're going to do is we're going to do the KV here. Line it up again. Lined up again here. We're going to center up the Elliott crest again. Alright, sir. I'm going to take another deep breath in, let it all out, and hold it. Alright. So what we're going to do is in the RPO position. Have it go again, angling sponge here. So don't turn on your side there. Alright. You alright?
Yeah. Thank you, sir.
Get right through this, alright?
You seem very knowledgeable.
Thanks. Alright, so what we're going to do is Elliott crest again. Get it lined up. Alright, just right there. Straight up and down. Alright, sir. Go ahead and take another deep breath in. Let it all out. And hold it. Beep. Alright. So what we're going to be doing now is the cross table rectum. So what we're going to do is center the X-ray tube to the ASIs, 40 to 48 inches. We had 2 inches posterior to the body. Right there, make sure we're lined up. Film holder there. This is being graded. Graded right here. Oh, good. Alright, so if I shoot this at 110 at like 50 to 60, like going armor penetrating to be a lot, so.
I don't know, sir. I'm a patient.
So I'll be using 110 at like 40?
Good.
Yeah, 110 at 40. Alright, so we're going to take a deep breath, let it all out, and boom. Alright, so our next shot here, what we're going to be doing is the left lateral DQ. We're going to center at the Elliott crest here. Alright. Like this. And put our left marker on top since it's our right marker, sorry. Right marker up since his right side's up. Just like that. And we're lined up. Make sure we're collimated correctly here. Alright, so we're going to shoot him at 110 at like 20 again, like 15. Alright, so we're going to take a deep breath, let it all out, and hold it. Alright, breathe. So now what we're going to do is, alright, so next, after that one, we'll be doing the right lateral DQ. And what we're gonna do is put the left marker on top since his left side is sticking up. And we're gonna do the same thing. We're gonna center at the iliac crest. A little bit right here. Center down. Okay. Look, we're centered. Alright, so what we're gonna do is another same thing, 110 at like 15 to 20. Alright, so we're gonna take a deep breath, let it all out, and hold it. Alright, so we just did all the overhead shots. So what we're going to do is have the patient go back to prone position, and we're going to pull out the tip, make sure we deflate the balloon. Alright, and then I'm going to pull it out. Alright. Alright, sir, go ahead and clench your butt cheeks there if you can. Great. Go ahead and get up if you can and go to the restroom and evac your solution there. Alright, it's red.
Alright.
Alright, sir. I can help you if you need to.
Yeah, please.
There you go. Alright, so Alfredo did good. This is the post-evac shot. So what we do is another KUB. He emptied out all his barium in the toilet. He had a lot of gas, but he's feeling alright?
Yes, sir.
Alright, so what we're gonna do,
Time of my life.
what we're gonna do is do the shot here, line up the bucket in the tube. We're gonna center at the iliac crest again. Right there. Okay. Alright, so you have your hands on your sides, please, if you can. Alright. So what we're gonna do is do another shot at 80 kVp at 40. Alright, so we're going to take a deep breath, let it all out, and hold it. Beep. After taking the overheads, after the barium enema with the patient, we want to go ahead and critique the images, make sure that we got all the anatomy that we need, and make sure everything's there. What we're going to do is look at the first image, which is the scout image. We got is we want to make sure that we got the diaphragm all the way down to the pubic symphysis here. We also want to make sure that we want to see an empty colon, because that's why we give the patient some laxatives and stuff, little preparations to be able to clear that entire colon. Next here, what we have is the left lateral D cube, and on this image here what we want is to check the air fluids. Also what we want to do is look at the lateral side of the ascending colon and the medial side of the descending colon. And what we have, let's bring up what we need for that. Next, what we have is the LPO AP oblique, and what we want to do is look for the ascending colon, seeing that it's opening up, and also looking at the right side, the right colic flexure, which is the hepatic. You also want to see the entire colon here. And on the LPO AP axial, you can see the difference between the axial and the regular AP. As you can see here, if we go back to the LPO AP oblique, we can see that the flexure here is pretty much superimposed here. And if we do a little angle to it, a little, axial view, you can actually see. Let me see here. The difference. See here? You see the difference there. So pretty much just want to just open that up and see that that flexure there, the hepatic flexure. Next, what we have here is the AP. Basically what we're looking for is seeing the sigmoid, trying to elongate the sigmoid and the rectum area. Basically we want to elongate the sigmoid because all the transverse and the flexures are all bunched up together, and we want to throw out the sigmoid to really view it. Let's see what we got next. What we have is the RPO oblique. And in the RPO, AP oblique, what we want to see is the left colic flexure, and then the descending part of the colon. And also, we want to view just the whole colon in general. Next image is the right lateral D cube, and what we want to see is the lateral descending colon, and then the medial ascending colon. And as well, we want to see the error in the fluid levels of the colon. And next is the cross table rectum, and what we want to see is basically just the rectum. See the rectum at the end of the sigmoid going all the way to the anus. That's pretty much it for that one. And then after we're done with the patient, we do a post-evac picture here. Want to see that the barium moved, and pretty much we shoot another KUB, but we still see a little bit barium still in the patient there. So this is our images, and this is critiquing. This is AJ Clevenger sounding out.